Hello to all of our Kaweah Delta advisors, ambassadors, and just community members who have jumped on this webinar. We are so glad you're here for our weekly update. Today is Thursday, June 4th, and this is our 11th weekly virtual meeting. Hard to believe. A few of you, like always, we're going to cover the questions that were submitted in advance. We're going to add those to our discussion, but the chat lines are open, so if at any time during this meeting you have a question or you want to comment on something that we are saying, feel free to chat that. We are monitoring it. And we post the recordings in the COVID page on Kaweah Delta's website under frequently asked questions. All of our virtual meetings are there. So if you ever just have nothing to do, go back and watch them. So our goal is to keep you all as informed as possible so that you can keep your friends and family informed. And I'm joined today, if you are by phone and can't see him, Gary Herbst, our CEO, is joining me. And we missed you last week, Gary.
Yeah,
so I hope you did something fun.
Yeah, relatively speaking.
Staycation, probably did some lawn work.
Yeah, maybe something like that, so.
Can you believe it's June?
I can't. Yeah.
At the end of the year, we're going to look back and say, what did we do this year? Oh, we woke up, went to work, went home, went to bed, woke up, went to work.
It's a blur.
80 days.
Yeah. And I know that it physically is not possible that the older you get, the faster time flies. But I think everybody will acknowledge that. Yeah, I feel like it was just January.
Right.
And now it's June and the year's almost half over, so
right.
Incredible.
Right. This was supposed to be the Roaring 20s, 2020, the Roaring 20s, but don't think so. Well, let's get started and let's go ahead and start with, I know with everything that's happened in the last week and a half, you kind of have put off talking about COVID because that's not the story that's in the news, but it's still affecting our hospital, still affecting our community, stores are still closed. So let's start with the numbers.
So I would say, it absolutely is still our story. Mm-hmm. Obviously there's so much more going around in the world right now, in our country in particular. It's a incredibly difficult, heart-wrenching time to watch our country, who's been battling through this unbelievable, unimaginable pandemic, and then now to be facing another crisis, another strife in humanity is it's so sad. So, but thanks for having me back. It's good to be back. I do want to give a shout out to Carrie Nowinski and Ryan Gates and Jag Bath. I hear they did an amazing job pinch hitting for me. So thanks to the three of them. I really enjoy watching them and listening to them. I learn a lot. They're just great presenters, and I hope everybody got a chance to enjoy the perspective and the information that they bring, because they were very much on the front lines of dealing with this pandemic. So yeah, when you spend 25 years as the CFO, you will always be known as the numbers guy. So hopefully you were able to kind of stay in touch this last week, but I will give you a rundown. My traditional, starting at the high level and working down to the local level. So this is all as of yesterday, Wednesday, June 3rd. So at the state level, the state's reporting just shy of 118,000 confirmed COVID positive cases. Give you a few characteristics about that. So 58% of those that have been infected, those 118,000, are younger than age 50, thereby leaving 42% that are older than age 50. Not that that's a huge difference, but interesting how a majority of the cases have been in the younger population. From a gender standpoint, pretty much equal, 49% female, 51% male, so pretty much affecting both genders very similarly. Of those 118,000 that have tested positive for the virus, there are currently 3,090 of them that are in a hospital today, which that number of hospitalizations has been declining, so that's very encouraging news. And of those 3,090 that are hospitalized, roughly 35% of them are in the ICU. The other 65% are being cared for in general medical surgical units, which is very similar to what we've been experiencing here that I'll share with you in a moment. And then sadly, the tragic part of the pandemic is those that have lost their lives to the virus. And in California, we've had now 4,361 deaths. Bringing that down to the county level, and again, keep that in perspective, 118,000 positive cases at the state level. In Tulare County, as of yesterday, we have 2,026 confirmed positive cases. They don't break out the age distribution exactly the way that the state does, but 907 of those 2,000, or about 45%, are younger than the age 40. So at the state level, you have 58% that are younger than 50. Here in Tulare County, 45% younger than age 40. So we definitely are seeing it in both the elderly population and the younger population. But as we know, it's been the elderly population that has been the hardest hit and have been those that are most hospitalized, and the greatest amount of deaths are in the older population. Of those 2,026 cases, a little over 20% of them are older than age 65. As of yesterday, Tulare County reported an additional death, so we're now up to 90 across the entire county. On a very positive, encouraging note, more than half, 57%, or roughly 1,200 of the 2,026 Tulare County residents that contracted the virus have now fully recovered. So more than almost a 60% recovery rate. There's still about 1,000 patients that have tested positive for the virus that are quarantined at home and still trying to recover from that. One thing that we've talked a lot about is what we call the positivity rate, and that's what percentage of those that are being tested actually test positive. Just a few weeks ago in Tulare County, it was running as high as 13%, which was significantly higher than the 8% or less that was required by the state to be able to move into the advanced stage, or the advanced stage 2 of the reopening process. As of yesterday, Tulare County's positivity rate is now down to 5.7%. So that's wonderful to see. Just in a few weeks that we went from 13 all the way down to 5.7. We definitely are continuing to test more. I think if you go on to the county's website, there are roughly 22 sites that are designated for specimen collection. Very few to almost none of them actually do the testing there, but they collect the specimen and they send it either to the county, could come to Kaweah Delta, oftentimes going to a commercial lab. I know skilled nursing facilities are always of great interest to our community, since that's where we've seen the hardest hit in Tulare County. There are 17 nursing homes in Tulare County that are actively reporting their information to the county. Those 17 nursing homes currently have 1,124 residents that are living in those nursing homes. 365 nursing home residents have now tested positive throughout this pandemic, and as we know, they've seen the greatest number of deaths. Of those 90 that have died countywide, a majority of them have been from those nursing homes. But according to the county's website, there are now only 20 nursing home residents that are currently actively positive. They're being managed, so that's good to hear.
Yeah.
Also, just the hospitalization rate in general across the county. When we were at our peak back in kind of mid-May, we were literally seeing about 25% of all COVID positive patients were being hospitalized. Today that's down to 2%. And that's been holding pretty steady over the last 7 to 10 days, that only about 2% of those testing positive end up being hospitalized.
Why were 25% hospitalized then and now only 2%?
Well, it's interesting. I'd be speculating, but I think we're seeing more positivity in younger people.
Okay.
Unfortunately, I think That's the population that's increasingly the most restless. The younger population is generally those that are still active, they're working, they have young families, those that have lost their jobs or, have been furloughed and they're home. I don't know, again, I'm kind of guessing, but I think it's that population that probably, and it'd be interesting to see, that the percentage distribution across ages, to look at that over time.
Right.
Or if, those that have tested positive in the last couple of weeks, it'd be interesting to know, what if 80% of those are that young population? But they have a much better ability to fight it on their own and not have to be hospitalized. So I think that's a pretty reasonable assumption, but I don't have any data to really back it up. But so down to the Kaweah Delta level, today we have 33 positive COVID patients in-house, which is up from where it was. We've been consistently down in the low to mid-20s as we were seeing this kind of plateau. But we're just coming off the Memorial Day holiday, and I can look back since the beginning of March, and when Easter came, and then Mother's Day came, and now Memorial Day, we've always seen a spike each and every time. So 33 is definitely a manageable number for us. Just to let you know, those are all 33 of them are in the acute medical center downtown. 8 of them are in the intensive care unit. 5 of them are in the intermediate critical care unit. That's part of our 2 South unit. So that's a 29-bed unit that we've actually set aside a number of beds for the more critically ill. So we have 5 patients in that area. And then the balance, the remaining 20, are in the med-surg beds on 2 South. So again, that's kind of mirroring the state where I mentioned that 35% of the patients are in critical care. That's about what we're experiencing here. So there's actually a great number of patients that are successfully, they're being hospitalized, but they're successfully battling the virus. We've had many discharge celebrations, and we love those where we get to really celebrate somebody that successfully overcome the virus and is going home. Kaweah Delta has now collected over 7,500 specimens since the beginning of the pandemic. We are by far and away the largest collector of specimens, really supporting the entire county. We actually, over that time period, we had a positivity rate of 9.6%, but the county reporting now down to 5.7. I would suspect that we're probably very close to that. Our positivity rate was probably higher in the early stages of it. And we're seeing about 67% of the specimens we collect are people that are younger than 50 or younger than 50. That's those that tested positive. So unlike the state where 58% of them are under 50, in Tulare County, 67% of those that tested positive are under 50. So maybe kind of goes back to my speculation that
they can't sit still.
Yeah. So, and then lastly, just to round things out, we've had to date, we've had 86 of our employees, our healthcare workers, have contracted the virus. 37 of them have recovered. We still have 48 that are recovering at home. Only 1 of our employees still remains hospitalized at this point, and we're praying every day for them. At the state level, there have been 10,293 healthcare workers up and down the state that have tested positive, and unfortunately 63 of them have passed away during this time of the pandemic. So that's a recap on the numbers.
So we talked about 33 being our inpatient number.
Yes.
And so a few weeks ago, our hospital was really at half the census. And so we had plenty of space. We were spreading out. So our census is starting to increase.
Yes.
So how is our census now?
Yeah, thank you. And thank you for giving me that question in advance, because it gave me some time to, so I want to give you some perspective here. So the Downtown Medical Center, before we opened up the 5th and 6th floors of the Kaweah wing, which happened after the pandemic had broken out here, but I go back to March 12th, which was kind of like the beginning of it here officially in Tulare County. Our census was at 324 in our 403 bed medical center. So that's an occupancy rate of about 80%, so pretty full. We were kind of coming towards the end of the flu season, but it was still lingering. You fast forward to just maybe 2 months later, so May 10th, as you said, just a few weeks ago. On May 10th, our census was at 234. So we went from 324 to 234 in 2 months. That's an occupancy rate of 58%. So it had declined significantly, and it hovered at that low level for a very long time. Today, our census is actually at 345, or 86% occupancy if I just looked at those original 403 beds that were open. So we actually have more patients in the hospital today than we did back on March 12th, pre-COVID, so to speak. But fortunately, we've added 24 new beds on what we call 5 Tower. The 5th floor of the Kaweah wing is an intermediate critical care unit. And we increased the size of our NICU from 15 beds when it was in the east expansion to now 23 beds on the 6th floor of the Kaweah wing. So we went from having 403 beds to now 435 beds that are available in the acute medical center. So that translates to a census of about 79%. So very similar to that 80% census that we had at the very beginning of the pandemic.
But we still have space. We still have
Yeah,
space
yeah, and
if
if
we
you'll-
were to have a,
Deb, if you'll indulge me a moment, and I don't mean to take the group down into the weeds, but I thought you might be interested in this. So we have a 21 bed medical ICU on the west side of the hospital. That's where those COVID positive patients are being placed. So the 8 patients, COVID positive patients that are currently in the ICU, they're on that 21 bed ICU. We only have 3 beds available on that 21 bed unit. There are 18 patients in there right now, 8 of which are COVID positive. The other 10 are just there because of heart attacks and strokes and other, serious, highly acute conditions. So only 3 beds available there. The 2 South unit, the 29 bed unit that we dedicated to COVID patients, there are 24 patients on that unit right now. They're all COVID positive. That leaves 5 beds on 2 South. Our 11 bed Broderick Pavilion, which is largely a surgical unit, 7 of the 11 beds are occupied. That leaves 4. Now as I talk about 4 Tower, 2 North, 3 North, 3 South, 4 North, 4 South, they're all roughly 35 bed units. Every single one of them is at full capacity. There's not a single empty bed on any of those units. So definitely,
okay.
yeah. So between the ICU and 2 South, there are 8 beds there, and there are 4 beds on the Broderick Pavilion. Other than that, in the Mineral King wing, the older part of the hospital, every bed is full there. And they're not full of COVID patients. There are no COVID patients that are on any of those units. Again, starting back up surgery a few weeks ago has added some volume, although we're limiting the number of elective inpatient cases where the patient's got to recover in an acute inpatient bed. We're limiting that to roughly just 8 patients a day. That's being done purposely. But it's just the normal things that we take care of all the time during non-COVID, periods that people are, for some reason, starting to experience those injuries and illnesses again, or they've had them the whole time and they're finally feeling comfortable coming back to the hospital, or it's got to the state that they have to come to the hospital. So, but we do have some capacity. We have 10 beds that are open on 5 Tower, the intermediate critical care unit. We have 11 beds that are open on 3 West, 9 beds open on 4 Tower, which is our cardiovascular unit. The pediatric unit, which is 12 beds, is still shut down. We're taking care of kids in the mother-baby unit. So those 12 beds are open. So overall, we probably have about 40 beds that are open, and that we might have to shuffle some people around,
Yeah.
because we're trying to cohort COVID patients by themselves. But if we did get hit with a new surge, we would have some capacity. We also we have 45 acute rehabilitation beds out on our West Campus. Our census today there is 14 patients. So we have, another 31 beds that are out on our West Campus. They're really not designed to take care of acute medical patients, but they could in a pinch. We could do that. One of the things that I don't think I've shared with you here, because it's really is just becoming a bit of an issue right now, is right now we have 22 patients that are in the hospital that are COVID negative, and they should be discharged, and they should be discharged to a nursing home. So they're not ready to go to their home, or a nursing home is where they live. There are 22 patients in acute medical center beds today that are ready to be transferred back to a nursing home, one of those 17 nursing homes. But those nursing homes will not take those patients. In fact, they're not allowed to take those patients in accordance with the state's new regulations that are governing nursing homes. And I certainly understand so many thousands of patients across the country died in nursing homes, very lax regulations, very lax infection prevention regulations, but that has changed dramatically now.
So even though they're negative,
They're negative?
COVID negative,
Correct.
they still, okay.
But
So
the
when
nursing-
will they open that up?
And not until the state. The state now requires that every single patient in a nursing home has to be tested for COVID. And then every so many weeks or months, at least 25% of all the residents need to be retested. And so that's going to continue for some period of time, where the state's going to require this repeated retesting of both residents and employees to, again, safeguard. But they're not ready there yet. So they're not allowing hospitals to discharge these patients. So one of the things we're working with the county on is the old Porterville Development Center in Porterville. The state owns and operates it. They have refurbished it to be able to serve as like a 150 bed alternative care site. But they don't have staff, they don't have supplies, they don't have equipment, they don't even have the beds there yet. But they think they could make it operational within a couple weeks. We're trying to work with the county and the state to potentially use that as a healthy nursing home alternative, so that we could discharge these 22 COVID negative nursing home patients to that facility, thereby opening up capacity here, which is where you'd want to take care of hospitalized COVID patients. So it's a bit of a dance right now, and we need the state's cooperation, but it is frustrating, and it's probably what keeps us from opening up a little bit, limiting the inpatient surgeries to just 8. We could probably slowly increase that if we had the greater acute inpatient capacity.
That is really hard for families too.
Oh, absolutely, yeah.
Wow. Okay, so you referenced major events like Easter, Mother's Day. There seems to be a slight surge after each of those. So one of our community members sent us some questions asking us how well Kaweah Delta is equipped for the new wave in light of the protests and the rallies, because there's not a lot of social distancing
No.
happening around those. And so, how equipped are we to handle that? And then they also wanted to know, how equipped are we to handle injuries caused by those protests or riots? And so far, I don't think we've had a few injuries here. I know last weekend there was an injury. So, how equipped are we to handle those at our facility?
Yeah, as I mentioned in the past, Kaweah Delta practices every single year. Multiple times a year, we practice for any and all types of scenarios. We practice for the Kaweah Delta Dam to burst and flood the entire city of Visalia, and what would we do if it flooded our basement, which is where our laboratory is. And so I don't think we've ever practiced, a riot. We definitely multi-car pile-ups on the highway where you have multiple injuries, some type of pesticide spraying a school or something like that, where we're inundated with hundreds of patients unexpectedly. So that's why we have the Hospital Emergency Incident Command System, which is what we're exercising right now in a real life situation. So we practice erecting that command center, deploying all these resources, calling in people. That's just what we do all the time. All hospitals are required to do that. So fortunately, we haven't had the violence that we've seen in some of the large metropolitan cities. We certainly, understandably, have had protests, and I think those protests will continue, but fortunately they've been peaceful protests. I did see the two young girls that got bumped by the Jeep, and fortunately they were minor injuries. So no matter what could potentially lead to a surge, whether it's Memorial Day and all the gatherings that occurred, or it's the opening up of the economy and society, or it's the protesting that brings people close together and in large numbers where they don't practice the social distancing and everything that we're looking for. No matter what the underlying cause of a COVID resurgence, we're ready. But again, it depends a lot on just how severe that surge is, and being able to coordinate well with the county, being able to use that alternative care site if necessary. The biggest challenge we have right now is staffing. We have, I mentioned, 40-something employees that are positive with the virus, and they're successfully fighting it at home. They're quarantined. They seem to be doing really well, and we're looking forward to them coming back to work. But many of those 40 employees are nurses, RNs, and so it's been a challenge to fully staff the hospital as the census has continued to grow. We actually are working with the county on potentially enlisting volunteer healthcare workers, or I think maybe close to 120 volunteer healthcare workers that have formally enrolled with the county that are willing to come. Even some come work with COVID patients. We have RNs and LVNs and MAs, but staffing has definitely been the biggest challenge, and that will continue to be the biggest challenge if we get hit with a big surge.
Right. So one more question about the unrest. If there is a march or a protest on Main Street, do we make the decision to lock down the hospital?
I don't think we've considered that
Okay.
At this point. I mean, we definitely have gone into lockdown before. Incidences that do occur outside the hospital that involve law enforcement, active shooter, which is also one of the things we practice.
Right.
But we do go into lockdown mode. I mean, we still have our no visitor policy in place. So in some respects, we kind of are in lockdown. Employees are only allowed to come in through designated entrances and can only enter in with an authorized badge. But yeah, I guess the quick answer would be yes. If we were concerned about that protest spilling over into the hospital and creating disruption, or unnecessarily bringing exposure into the hospital, then yeah, we very easily could go into lockdown. We employ our own security forces. We don't contract that out. We have a very strong security force. Yeah, they'd be prepared for it.
Okay. All right. So regarding our homeless population, why have we not heard how COVID is affecting the homeless?
Yeah, and I wish I had an update on that. I do know that Dr. Guzman, Dr. Kaweah from our emergency department, who are really kind of the founders behind our street medicine program. We kind of suspended the street medicine program for a period of time, but it has started back up. And that program is designed to actually go out into the community and work with the homeless. And they have been doing that now for a number of weeks, and they actually are out there in the community testing the homeless for the COVID virus. So they're out there swabbing them and then bringing the specimens back to our lab for testing. And I believe the last report I had is that there is a pretty low positivity rate among the homeless, which I think is surprising
Right.
to a lot of people. I have heard in other communities where there have been breakouts in homeless shelters, but I really haven't, Visalia Rescue Mission, I really have not heard or read anything about having outbreaks among the homeless.
And it could be the younger population too, because a lot of our homeless in this area seem to be
Yeah.
Under 50. I don't know, and I might have just
And-
made that
and,
up. But it
bless
seems-
them if they're practicing great social distancing.
Right,
And,
right.
Yeah.
Okay. So now that our elective surgeries have opened back up, you've discussed that a little bit. Are our ORs staying busy? When do you think we will expand that to even more than the 8?
Yes. Great question. I knew I had it here in front of me. So yeah, let me. I'll go back to March 12th. Again, I referenced March 14th. Right around that area, I think, is when we had our first reported positive COVID case in the county. And we did 49 surgeries on that day, inpatient and outpatient, probably running 10 to 11 operating rooms. That case volume fell down to around 20 per day throughout April and May. That's when we were really knee-deep in the pandemic. We had shut down elective surgeries, a lot of procedures, literally saw our surgical volume cut in half. So back on, I think it's May 20th, I can't remember what that Monday was.
May
Maybe it was
18th.
May 18th?
Wasn't it May 18th?
Yes, I think
That
you're
seems
right.
to be a date we talked about a lot.
Right.
Yeah.
So on May 20th, we did 51 surgeries. So that's the highest number that we've done since all the way back to March 12th. In fact, did 2 more cases than we did back pre-COVID. Just a couple days ago, we did 53 cases. So in terms of total surgery, we're back to where we probably were pre-COVID. We're running pretty consistently about 11 operating rooms. But what's different is the mix of those surgical cases between inpatient and outpatient. So most of the return of surgery has been on the outpatient side. On the inpatient side, again, we are deliberately kind of constraining that to the 8 cases per day. Again, and even those, while they're inpatients, we're pretty much doing joint surgery where it might be a 1 or 2 day stay. So we're always kind of keeping ourselves right there on the edge to just again waiting, watching what's going on in the community, and if we need to ramp back, we could. I just got off a call with Jag and Ryan earlier this morning, and we are going to begin, I think this coming Monday, we're going to go from 8 cases on Monday to 11 cases. Doesn't sound like a lot, but 3 more inpatient cases. Again, we still continued through this whole pandemic to still do 20, 25 cases a day. Many of them, trauma,
Right.
true emergencies. most always they're inpatients.
Mhm.
So we continue to do a lot of inpatient surgery, but it's now what additional inpatient surgery, the elective surgery. So we feel comfortable with our current bed utilization that we can go up to 11 on Monday. We're going to go from 8 to 9 on Tuesday, Wednesday, Thursday, and then back to 8 on Fridays. So we're just going to kind of inch up just a little bit, and then we'll continue to make adjustments each week as, again, we see things, how they kind of play out.
Yeah. Okay, so you referenced that we are now at the 5.7%
Positivity rate.
Positivity. We
Right.
needed to be under the 8.
Correct.
So how does that affect the reopening of our county?
So there were a number of metrics that we had to meet. I remember we were named one of the 5 counties that, by the governor, that was not permitted to go from early stage 2 to advanced stage 2. Some people call that 2.5. 2.5 is where now restaurants could open up to in-house dining, provided, you know, you separated tables and you had to implement a lot of safety precautions. But in-house dining could open up, in-store shopping opened up, schools could open up with certain modifications. So that was the advanced stage. So because we were able to demonstrate that we met all the metrics, one of the most important being that positivity rate, a week and a half, maybe 2 weeks ago, Tulare County was permitted to move into 2.5. The next phase is phase 3, and that's where gymnasiums like the Lifestyle Center can open up, but we're not there yet.
So how long do you think it will be?
I don't know. The governor has said weeks, not months. You know, it's going to be interesting. I don't know if folks were following this, but there's been a very sizable outbreak in the town or city of Mexicali in Baja, California, so just kind of over the border. And unfortunately, in a single day, they reported 180 deaths in that town. Over the weekend, myself and many hospitals up and down the state received an urgent email and text message from the California Hospital Association, the president, asking any hospital all the way up to Sacramento if they would be willing to take transfers of these patients, COVID positive patients, into our facilities. There are 2 hospitals down there kind of in the Imperial Valley, El Centro and Pioneers Memorial Hospital. They're both district hospitals, but much smaller than Kaweah Delta, but they're full. In fact, they've gone on diversion, which means they turn ambulances away. They simply don't have an empty bed to admit patients. So it's pretty desperate down there. But to ask hospitals all the way up to California to accept those transfers, and unfortunately, my answer had to be no. We don't have the room. We're preparing ourselves for potentially a localized surge, and we have to be ready to take care of our own community. So, yeah.
Okay. Well, that's sad. That's hard. That's hard to do.
It
right?
is, yeah. I mean,
To turn away, yeah.
You know, hospitals, especially district hospitals, there are only 35 of us
Right.
that are still left in the
Right.
state, and we all belong to a special association of district hospitals, and we're always there to support one another. And so, yeah, not being able to support your sister hospitals at a time they're going through a pretty intense crisis doesn't feel good. But
Yeah.
obviously, first and foremost, our commitments to our own community.
Right, right. Okay, I have a couple of questions that have come in. How is the antibody testing going? How many have been tested? How are the results? And are we reaching herd immunity as everyone had hoped?
Yeah, great question. Thank you. So, so we rolled it out, a week and a half, a couple weeks ago. As of yesterday, we had invited 3,000 of our 5,000 employees to be tested for the antibodies. Again, the blood test, and we don't do a finger prick. You come in, you get a full vial of a test tube of blood drawn for this particular test. Again, we started with all of our employees and physicians that had the greatest interaction with known COVID patients or suspected COVID patients. So that even meant, the housekeepers that clean the units, the phlebotomists, the lab, the imaging techs, anybody with the food servers, anybody coming into contact. So as of yesterday, I believe we had about 800 employees that have taken the test, and we have about 18 of them have come back positive.
18?
Yeah, very interesting.
Yeah.
So last week we had 400 that had taken the test, and only 8 of them tested positive for the antibodies. So now twice as many tests and just about twice as many positive. So it's a interesting low rate. I don't know if I was expecting more, but that would have meant, and again, the percentage of positive but asymptomatic patients, people talk as low as 5% to as high as 80%. And it's really that population that we were hoping to identify, that we were going to see a significant number of our employees that experienced no symptoms whatsoever, but had the virus and beat it and developed the antibodies, but that doesn't seem to be the case.
Yeah.
And these are the employees that had the greatest
So
exposure.
did they follow up though with more, I wonder if they're following up with more questions. So like if somebody has positive for the antibodies, I wonder, were you sick at all? Did you have these symptoms? That would be really interesting to know.
Yeah, and I think because the sample is still pretty small.
Right.
Because our ideally, we'd love all 5,000 employees and our 700 physicians and advanced practice providers to take it. Remember, it's not mandatory. It's totally voluntary. And again, provides you no assurances of immunity, partial or full. If you were immune, how long would it last? So we're always very careful to tell people it's really informational in nature, and we need probably more and more people to take it so we have a large enough sample so we can start doing, the data dissection and trying to see, what conclusions, if any, what does this teach us? What can this help us with the future? It is going to be interesting to see if when we're all said and done, that we do end up with a high percentage that were asymptomatic but have the antibodies.
Right, very interesting. Okay, another question. Has any information emerged showing the air quality issues in the valley have increased COVID infections or impacted outcomes?
I have not heard anything specifically. Obviously, one of the most serious effects of the virus is its impact on our respiratory systems. It tended to be, that was one of the very first identified symptoms, runny nose, cough, lower respiratory distress. So many of the patients that have died of COVID have died of respiratory failure. And so we do believe that patients with chronic obstructive pulmonary disease, COPD, patients with asthma, patients with other underlying respiratory conditions, valley fever, are they more susceptible to contracting the serious aspects of the virus? I think it makes sense given how the virus manifests itself in patients, what we've seen and the causes of death. A lot of them, as I talked about, the underlying comorbidities that we have seen in virtually every single death that we experienced in the hospital had one or more underlying comorbidities. And asthma was a big one. COPD, congestive heart failure, all of those were major contributing factors. But I've not seen any studies that have been done that have tried to directly link the quality of our air to a higher prevalence of the virus in our area.
Okay, thank you. So any updates on the no visitor policy?
Yeah, unfortunately it has not changed yet. We're still following the original no visitor policy that we did put in place. I will tell you, we reevaluate it every week. There's a lot of pressure that that's being exerted from the outside, but just pressure we feel internally. We're a caring, compassionate organization. That's what we do. That's what we're about, and so it's just gut wrenching, heart wrenching for us to not allow visitors in at a time when their loved ones are the most anxious they'll probably ever be.
Right.
So we still definitely have the exceptions, people that are dying, those that might have some mental health challenges, can't really make decisions for themselves, a woman having birth, a child, a minor that needs to be accompanied by an adult. All those exceptions continue to be in full force. But we will, again, we're kind of in that wait and look mode right now. We're just bracing for Memorial Day, bracing for the reopening, the relaxation. If everybody keeps doing all the great things they've been doing, we should be great. But we can't be certain, so I think we're going to wait a little bit longer. And if things seem to remain calm and we continue to hover around the 30 patients or so, then we'll start feeling more comfortable relaxing the visitor policy.
Okay, thank you. So regarding the financial impact of COVID on Kaweah Delta, you've referenced that a couple of times, and there was also an article, maybe a couple of articles about it. But do you and does Kaweah Delta have a plan to assist with the financial recovery of the district?
Yeah, we're working on that plan right now. In fact, again, just before I came over here, our whole executive team, all our vice presidents, met for an hour and a half. It was our normal weekly meeting, but we devoted a good part of the latter half of it to talking about next year's budget. Our fiscal year starts on July 1. Runs July 1 to June 30, so we're just less than a month away from starting the new fiscal year. We're going to be meeting with our board in a couple special sessions over the next few weeks, leading up to when we'll present that budget to them at their June meeting to hopefully approve the budget for next year. Probably the most difficult budget experience I've ever had in my career here. Just there's always uncertainty, about the future. Going into the budget, we never know what Medicare or Medi-Cal or, what we might experience. The federal fiscal year doesn't start till October 1, so here we're starting our year before we even know what the federal government's going to do with the reimbursement rate. So there's always that uncertainty, but now not knowing for certain, what is our census going to be like? What are surgical volumes going to be like? And so we're going through and doing a lot of what-if scenarios. We're unfortunately we're looking at some hard decisions that might have to be made to affect that recovery you're kind of talking about. Great to see surgical volumes and others coming back, but is this a year that we can't implement a pay raise? That we have to freeze wage rates? Do we freeze hiring? Do we look at services that are subsidized right now, but they're an important part of our continuum, but a lot of hospitals are kind of rethinking, maybe that's not a service we can offer anymore because we just don't have the financial wherewithal to support something like that. So the plan is under development right now. It's not an easy plan, and will be greatly impacted by the amount of revenue, the stimulus funds that come from the federal and state government. We haven't received any stimulus money since that early distribution back in March or early April. So we're kind of hanging out there on our own. We hear a lot of activity about having more funding flow to hospitals, but again, that will have a big impact on what that plan looks like.
Right. Okay, thank you. So Phil Bordette, you have your hand raised, so we're going to unmute you if you have a comment. Are you there, Phil? Maybe he just raised his hand to give us like a high five. High five. Okay, well, there seems to be no questions, so Gary, thank you so much
Yeah,
for
thank you,
joining
Deb.
us
Good
again
to be
this
back.
week. And
Yeah.
it's always good when you guys log on and just get information from us, because it's our desire through these webinars to keep you as informed as possible so that you can turn around and inform those around you. So we look forward to, of course, seeing your faces in person, and you have a great week and a good upcoming weekend. Stay safe. Thank you.